On the 28th of July, the provincial health authorities in northern Kivu province in the eastern part of DRC notified the Ministry of Health of a suspicious cluster of cases and deaths in Mabalako Health Zone, with the epicenter being Mangina Health Area. Following the further investigation and sample collection, on August the 1st, the Ministry of Health of the Democratic Republic of Congo informed WHO that of the 6 samples collected, 4 had tested positive at the National Research Laboratory. Yesterday, after initial lab work, we can now say that it's very likely that not only do we confirm the outbreak of Ebola, you remember we called this presumptive in previous communications, but it's extremely likely that it's Ebola virus Zaire strain. We're still very early on in the investigation process, and the majority of the cases that are being referred to in different documents are suspected cases, apart from the 4 cases that have been confirmed in the laboratory. We know, for example, that there have been around 20 deaths, but we can't at this stage confirm whether they are all probable or confirmed Ebola cases. We expect, however, that the overall case count will rise in coming days to weeks based on the trajectory of epidemics at this stage in their development. What about the context of this outbreak, and particularly in comparison to the context of the outbreak in Western DRC when we last met? It's very different. The earlier outbreak, we spoke about constraints being logistics, about constraints being related to the fact that health workers were infected early in the outbreak, that we had multiple locations to deal with simultaneously, that it was really abutting upon the rainforests in the western side of the country, and that it had proximity, and indeed you'll remember that early on in the first few days we had confirmation that the town of Bandaka was infected, and we had proximity to major cities and also to borders via the riverine routes through Central African Republic and the Republic of Congo. So in this context, in the eastern part of the DRC now, unfortunately we have many of the same constraints and complicating factors regarding logistics, regarding health worker involvement already, and 1 health worker has died, we believe, already. Proximity to forests, multiple locations, we're already tracking contacts in 10 physical localities already. Proximities to borders, this time the border with Uganda, which is only 50 kilometers away. But in addition to that, we have one very serious additional complex factor, which is the issue of security. Here we're responding to an outbreak of this high-threat pathogen with one of the highest mortality rates of any known diseases, but in the context of a war zone. So in terms of degree of difficulty scales, we're at the top of the degree of difficulty scale in terms of responding to this outbreak. We've conducted a risk assessment. We've rated that the risk is high at the country level, high at the regional level, and thus far low at the global level. In terms of actions taken so far, along with, of course, under the leadership of the Ministry of Health, and along with critical partners, again, the mainstays of the partnership being alongside WHO, UNICEF, and we'll hear from our UNICEF colleague in a moment, the International Federation of the Red Cross, and Red Crescent Societies, Médecins Sans Frontières, and again we'll be heavily reliant here on logistic support from both the World Food Programme and MONUSCO. Remembering that Goma is the capital for the base of MONUSCO, the peacekeeping operation, with more than 20,000 UN peacekeepers in place, and the largest peacekeeping operation that the UN is responsible for worldwide. In terms of actions taken to date, WHO has activated its contingency financing envelope, its incident management system. This is characterized for WHO as a level 3 emergency. We have begun deployments. We have 20 at least, actually. By today we expect that number will increase to 30 WHO staff on site in Beni as of yesterday. and we have at least 50 more potentially in the pipeline, some of whom will be repurposed from the operation in Equator province. The mobile lab has been deployed as of yesterday. And in terms of immediate program priorities, really the critical first priorities are the getting a handle on the outbreak itself, so really doing that characterization of understanding the outbreak, because the data we've presented today is very preliminary. Doing the contact tracing work around those confirmed cases, ensuring infection prevention and control, particularly around health facilities. As I said, already one health worker has died. We know at least 2 have been infected. And of course the outreach to communities and the risk communication and isolation and care of patients. So they're the top priorities. We're working on all of those as we speak. And I'll pause there because I know our UNICEF colleague will have more to add, and I'm happy to answer questions. Thank you.